Hello. This film's been made to help you understand some of the information you might need before considering whether or not to join the canakinumab study. It's meant to add to details in the patient information leaflet and the discussions you might have already had with your doctor or research nurse. The film is split into different sections, so you can easily replay any parts of particular interest. You'll see explanatory diagrams, a doctor explaining what the study is about, the screening tests needed, and what's involved if you take part. There's also a section where people just like you have an opportunity to ask a doctor questions about the study. Watching the film might make you think about other things you still need to discuss with your own doctor or nurse before making a decision. Some people also like to view and talk about it with family or friends. The study is an important international clinical trial open to 1,500 patients from across the world. Doctors hope that several UK hospitals will also join in. You've been invited to participate because you've had surgery for non-small cell lung cancer. Depending on the stage of your disease at diagnosis, you might also have had chemotherapy or chemotherapy plus radiotherapy after your surgery. Doctors now want to see if a drug called canakinumab is safe and effective in preventing the reappearance of lung cancer. In the next part of this film, I'll be interviewing a lung cancer specialist, Professor Dennis Talbot, about the drug canakinumab and the study. Professor Dennis Talbot, thank you so much for agreeing to talk to me this morning. I wonder if we could start by you telling me a little bit more about why this new trial study is so important.
Well, the main purpose of this study is to see if the addition of canakinumab will increase the disease-free and overall survival of people with lung cancer who have had surgery or chemoradiotherapy.
Okay, so this is a very new drug, canakinumab. How does it work?
Well, we know that the formation of cancer is dependent mainly on risk factors, including smoking, that cause inflammation. Let me show you how canakinumab works. Lung cancer develops over several steps or stages. The four main ones are firstly initiation, the development of a cancer cell from normal cells. Secondly, promotion. This is the growth of cancer cells into many cells or a tumour. Thirdly, the development of blood vessels. Cancer cells induce the growth of new blood vessels to supply them with nutrients and oxygen. This is called angiogenesis. And finally, metastasis. This is the spread of cancer to other parts of the body. There are many types of chemical messengers in the body called cytokines, and here they're represented by the yellow triangle. These interact with the cancer cells, promoting them and allowing angiogenesis and metastasis. Canakinumab interferes with this process by binding to the cytokine interleukin 1 beta. Canakinumab is shown here in the blue figure. This binds directly to interleukin 1 beta, thus preventing its interaction with the cancer cells and interferes with each of the four steps of cancer development that we described.
That's really interesting. So this new drug canakinumab, it's rather different, it sounds, from some of the drugs that patients with lung cancer might have already had.
Yes, and the patients who are going to this trial will have had standard chemotherapy, cytotoxic chemotherapy, which is associated with a wide range of side effects. Canakinumab is a different type of drug. It has a whole spectrum of different side effects, but generally it's well tolerated. We know it's a type of a drug called an antibody. These are used in other types of diseases.
So can you tell me a little bit more about that? How was this drug developed?
Well, a study was done on patients who had heart disease, they'd had a heart attack, and a study was done with canakinumab which showed, rather surprisingly, that those patients receiving the drug had a lower incidence of lung cancer, and there were significantly fewer deaths from lung cancer in that group. So it's thought that canakinumab might actually reduce the effects of lung cancer development and may be useful in patients who have just had surgery for early stage disease.
Okay, this might sound like a rather strange question, but if you've already found that to be the case when you were looking at people with heart disease, why do you now need to do this clinical trial?
Well, it's very important to test the drug in the population, people with lung cancer, to demonstrate that this indeed is the case. It's testing a hypothesis that the drug may have a positive effect in people with lung cancer. Most people believe that the early stage disease would be the ideal population to evaluate in a randomized clinical trial.
Okay, so we need the study to show that it actually really does work, because the previous one was just a big study where it was an association you found.
Right.
Okay, I understand. Now, you have already alluded to the fact that there are some side effects, but what has been the experience so far for patients who've been having it?
Well, many thousands of people already received this drug. Some people who are relatively healthy compared to people with lung cancer. It's shown that it does have some side effects that may increase the rate of infection, for example, and particularly inflammatory changes associated with infection. But many of the side effects associated with cytotoxic chemotherapy used in cancer treatment don't appear.
But of course, because patients will be in this big study, they'll be monitored very closely for all those sorts of things.
Of course.
Yeah.
In a randomized trial, we will want to evaluate not only the outcomes, as I've mentioned, but also side effects, how well the drug is tolerated, and also quality of life, which is so important for patients with cancer.
Well, it all sounds very exciting. So when in fact will the results of the trial be known?
Well, because it's early stage lung cancer, we expect many patients to live many years. And so the study won't be completed for maybe 5 to 6 years from the start. Okay. So we won't know the results for some time yet.
And if you look into your crystal ball, how much do you think that this new drug might be practice changing for the scene for patients with lung cancer?
Well, of course, we have to wait for the results of the trial, and that is paramount in how the drug can then be used for benefit for patients in the future. So I'm afraid we have to wait for a few years before that result's out.
Professor Dennis Talbot, thank you very much for explaining that to me.
It's a pleasure. Thank you.
It's very important before you decide whether or not to take part in this study that you understand what it will involve. So I'll summarise the main points, and don't forget that these can also be read in the patient information leaflet. Researchers want to find out if canakinumab is safe and effective in decreasing the reappearance of cancer in patients with non-small cell lung cancer that's been removed by surgery. If you agree to join the study, you'll be invited to sign a consent form and have some screening tests to make sure that the study is right for you. These screening tests are described in more detail later in the film. If screening shows that the trial is an option for you, then you'll be randomised to receive either canakinumab or a placebo, which is a dummy drug with no active ingredient. Neither you nor the study doctor can choose if you have the new drug or the dummy one. This is done using a process called randomisation. Details about you, such as your age, sex and stage of disease, are sent to the main study centre. Here a computer will quite randomly give you a number or a code, and this is then used to put half the patients into a canakinumab group and half into a placebo group. Randomisation ensures that everyone has an equal or 50% chance of receiving either canakinumab or placebo. The study is double-blinded, which means neither you nor your doctor will know if you're having canakinumab or placebo, as the injections will look the same. However, if needed in a medical emergency, your study doctor can find this out. Placebos are often used in clinical trials so that any changes reported by doctors and patients are not influenced by them knowing if they're getting the new treatment or not. You might think that randomisation seems a rather strange way to decide what you're given, but it's actually a fair, safe and scientific way to ensure that any findings at the end of the study are not biased in any way. All study medications, the active drug canakinumab and the placebo, are given by injections subcutaneously just under the skin. The best places to give these injections are the upper outer thigh, the abdomen, or the upper outer arm. You'll most likely be able to choose where you want to have them. 2 injections are needed at each treatment visit. Following the injection, you may notice some redness or bruising. This should disappear within a few hours, although occasionally some bruising remains for a day or 2. Your safety is very important in any study, so side effects will be monitored closely by the doctors looking after you. Some side effects from canakinumab are already known from other studies. Infections, typically colds, often develop during treatment because of the way the drug works. In a few people with weakened immune systems, much more serious infections have occurred. These are listed in the patient information leaflet, and if you're at all worried, please discuss them with your study nurse or doctor. Importantly, please tell the doctor about any vaccinations you might have had for things such as mumps or chickenpox before you start in the trial. You may need to have a 3-month gap before beginning study treatment. As with any drug, allergic reactions may occur, and these can be mild or more serious. Common symptoms include rash, itching, skin problems, swelling of the face and throat, or trouble breathing. If you think you've had an allergic reaction, you'll need to contact your study doctor and seek immediate medical attention. It's always difficult to predict who will or who will not have side effects, but extra care will be taken to monitor them during the study, and most go away when medication is stopped. If you're interested in joining the study, the doctors will ask you to sign a consent form and then conduct some screening tests. You'll have a complete physical examination, which includes measuring your height, weight, temperature, blood pressure, pulse and breathing rate. You'll be asked questions about your daily activities and have an ECG to make sure you don't have any heart problems. You'll have several blood tests, including one, if necessary, to rule out pregnancy. Tests will also be done on your urine and one test for TB. There are several scans needed, including a CT or MRI of your chest, abdomen, pelvis and brain. A whole body bone scan and a chest X-ray may also be performed if required. Sometimes the health checks carried out before and during the study might identify a medical problem that you didn't previously know about. In particular, you'll need to be tested for HIV and hepatitis B and C. Your study doctor will tell you the results, and if necessary, you'll be referred for suitable treatment. It's possible that after screening, you may be told that the study is not a suitable option for you. I'm now going to outline the likely timelines for treatment, for follow-up and tests, but these may change slightly during the course of the study. The doctors at your local cancer centre will always keep you well informed if the timelines are altered. You'll receive 2 injections under the skin at each treatment visit during the study. The first injections will be given at the beginning of the study at cycle 1 on day 1. Then every 3 weeks for a total of 18 cycles of treatment. This all takes approximately 54 weeks. You'll probably have to come to the clinic 5 times during the 3 weeks of the first treatment cycle, and then at least once every 3 weeks for approximately 54 weeks, which will be cycle 18. You'll also have the follow-up tests and investigations during this time. After finishing cycle 18, if you complete a full year of treatment, or earlier if you stopped study treatment, you'll come to clinic for an end of treatment visit. You'll then probably have 5 follow-up visits every 28 days for 130 days after your last study drug injections. As I've already mentioned, it's possible that some of the timings of these tests might change, but your doctor or nurse will keep you well informed about this. The doctors will monitor you for any signs of cancer reappearing for about 5 years after the first dose of study drug. In addition to the visits during the treatment phase, you will then have clinic visits every 6 months for years 2 and 3, and then annually for years 4 and 5. Thereafter, a member of the study team will most likely call you every 12 weeks until the end of the study to ask you about your health and any changes to medications, treatments or therapies. Each clinic visit may take a few hours, and for some visits you might need to stay longer if CT or MRI scans are required. The study doctor or nurse will inform you in advance on how long they would expect your visit to last. Measuring quality of life is another important part of the study. Questionnaires will be given out which let you report any symptoms you might be having and how these are affecting you, your mood and your life. The questionnaires don't take very long to complete. You'll be asked to fill in the first questionnaire before beginning treatment and then at specific time points. Please take a look at the informed consent leaflet for full information about this. So let's go over your options once more, and remember taking part is entirely voluntary. If you don't feel comfortable about joining the study, then you will receive treatment according to the standard practice in your particular hospital. your relationship with the clinical team looking after you will not be affected. If, however, you do feel comfortable about participating, then it's important to remember that being in the study might not benefit you personally, but the results will help doctors and patients in the future decide on the best treatments. We hope you found this patient information film useful. Remember, you should take all the time you need to consider the options, and if you've any further questions about the study, don't hesitate to ask your doctor or specialist nurse. In the next section of the film, you can see and hear some people just like you asking questions about the study, and Professor Dennis Talbot, an expert in lung cancer, providing some answers.
Hello Jill, thanks for coming along today. I understand that the study nurse has said that you've got some questions about the patient information leaflet you've read about this study.
Hello Dr. Talbot, yes, just a couple of questions. I don't really like needles. I don't like the thought of injections going into my tummy, so could it go anywhere else? Or
Potentially it could go elsewhere, but the volume of the dose to be given normally means that it's more comfortable to be given into the abdomen rather than somewhere else, such as the arm or the leg. So that's what we would recommend.
Okay. And also, obviously it's a lot of visits to the hospital. If I was on the other treatment, the normal treatment, would there be less visits to the hospital? Or
no, because of the nature of the study, we have to be very careful to monitor both the outcome of the trial and also side effects that you might experience and safety of the medication. And this means that we like to make sure that we see you at regular intervals to ensure that the drug is safe for you, to answer any questions that you might have, and to monitor safety. So yes, it does mean more visits than you would have if you didn't go into the study.
okay, yeah. Well, thanks for that. Thanks for that explanation, and I go away and think about it. But yeah, thank you very much.
If you do have any other questions, I think you've got telephone numbers to contact the study nurse and myself, so do feel free to contact us if you have any further questions or concerns.
Okay, thank you, Dr. Talbot, and I look forward to seeing you again soon.
Okay, thanks,
Okay.
Jill. Hello David, thanks for coming along today. You've had a chance to read through the patient information leaflet about the trial, and the study nurse says you've got some questions to ask about the study.
Well, I'm okay about taking part in the trial, but I really do want to know that I'm getting the real drug and not the dummy one.
Yes, I fully understand that, and if you're going into a trial, you'd want to have a potentially active drug. We'll be following up all patients entered into the study and documenting side effects and the effects of the treatment, and it's important that neither you nor I know whether or not you're receiving the active drug. And the reasons for this is to have a scientifically valid study, and it isn't a biased study. If I knew that you were taking the active drug, or you knew you were taking the active drug, we may be recording something slightly different just through bias. And so the study has to be done in this way to avoid bias and getting a proper scientific and accurate result of the study.
But it said in the notes that this drug isn't approved for lung cancer. So how do you know it's safe?
Well, canakinumab, the study drug, is approved for other types of disease. It's not yet approved for lung cancer, as you say. The purpose of the study is to show whether it would be helpful to have patients like yourself with lung cancer receiving the drug, and that's the idea of the trial.
But it's not been tested for lung cancer.
No, this is the first study in lung cancer. Previous studies have been done in patients with cardiac disease, particularly myocardial infarction or heart attacks. And in some of these patients, there's been a significant reduction in the incidence of lung cancer and also deaths from lung cancer, which gives us the information that perhaps it might be useful in people with the disease, reducing the rate of recurrence and overall survival of people with lung cancer.
Right. But what happens at the end of the trial after 5 years or however long it is?
Well, we clearly would like to follow up people who take part in the study over a period of time for safety reasons, and also to look at disease progression and overall survival. If you join the study, we would want to follow you up for at least 5 years, but we predict that it should not be longer than about 6 years. Most of the follow-up can be done by telephone contact with you, asking you questions about quality of life and side effects. So not each of the follow-ups would be necessarily in the hospital, it can be over the telephone.
So what happens if you see signs that I'm not getting better or possibly even getting worse during the course of it?
Well, of course, we'll be following up very carefully any disease recurrence, your side effects, quality of life. And if we find at any time that these are deteriorating in any way, then you would discontinue the treatment, whether it be the placebo or the study drug. We wouldn't know at that particular time. And you then go on to standard treatment.
Okay.
Hello Celia, thanks for coming along today. You've had a chance to read the patient information leaflet about this study, and the trial nurse says that you've got some questions today for us.
Yes, I have, and I'm a bit embarrassed about the first one because it's probably very obvious, but I wondered what the questionnaires are for.
Well, the trial has got a number of endpoints or studies that we would like to do, one of which is very important, and that is patient safety and quality of life. There are a number of ways of measuring quality of life. We're using validated methodology so that we can accurately record quality of life throughout the period that you're on the study if you choose to take part. These questionnaires have been developed across Europe and the world to show very accurately how patients' quality of life might change throughout the course of treatment. And so, because it's an important part of the study, we are including them and would ask you to complete the studies.
Okay, that's fair enough. Thank you. My daughter is a nurse and she went through the information sheet with me, which I was really glad about because I found it quite hard. The thing is, I look after my grandchildren for her and they get lots of coughs and colds, and I was wondering, am I going to have to avoid them? Because I believe that patients on the drug can get a lot of infections.
That's a very good point, and I'm pleased that your daughter has gone through the information leaflet with you. It's important that you're aware of potential side effects, and it has been shown with this drug, canakinumab, that infection risk is slightly higher. And so I would say and encourage that you do stay with your grandchildren, see your family. Don't avoid social contact with them. Just beware of the potential symptoms of infection. And I think you're aware of these from your period of time on chemotherapy, and report any side effects that you get at any time. But certainly don't avoid meeting your family.
God, well, I'm really relieved about that. Thank you. Well, what happens if I decide I want to withdraw from taking part in the study before the study ends?
Well, as the patient information leaflet shows and says, you are free to withdraw from the study for whatever reason at any time. You don't have to actually say what reason you're leaving the study, but you should feel empowered to leave the study for whatever reason at any time you wish.
Okay, thank you. That's reassuring.
Hello Tim, thank you for coming along today. You've had a chance to read through the patient information leaflet, and I hear from the study team that you have some questions about this trial.
If my lung cancer does come back, will the doctor see if I'm on the dummy drug, and if I am, would I go on to the proper one?
The advice I would give you is that if the disease unfortunately gets worse or grows while you're on the study, you would discontinue the study and go on to standard of care.
But there seems to be quite a lot of scans and tests and things that I need to go through. I live quite a way away from the hospital. If I wasn't in the study, would I still have to go through all these tests?
If you choose not to take part in the study, you would be followed up with regular attendances to the hospital and scans as part of standard of care. However, if you chose to take part in the study, you would need to have more blood tests, scans and hospital attendances. This is because we need to monitor safety of the drug and patient side effects. Over a period of 5 years or so, on average, I anticipate the number of additional attendances to be between 15 and 22 over that 5-year period.
Okay, great, thank you.